In this video, we're going to continue our discussion of the key fundamental concepts that are central to the study of quantitative methods. And that next concept here differentiates different types of numerical variables, and those are discrete and continuous variables. A discrete variable is one that's measured in units that cannot be subdivided. So there are certainly gaps that exist between the measured outcomes. In this situation, with these types of variables, variables are classified in whole units, whole numbers. So there are no fractions involved when we talk about a discrete variable. An outcome takes on a value of one whole number or another whole number. Can't take on a value in between. One example of a discrete variable is a dichotomous variable. Another example are categorical variables. A dichotomous variable is one in which there are only two possible outcomes: male, female, or a question that would only allow a yes or no answer. And we'll take a look at some examples of that in the next video lecture. Scores obtained that are discrete take on whole integers. As mentioned, there are no fractions. Another example of a discrete variable would be the number of people per household, which is measured in whole units. This is different than continuous variables, which can be subdivided, in theory, infinitely. And so there are no gaps between the possible outcomes of a particular measurement. So the variable is taken along a continuum. So in theory, as mentioned, a continuous variable can have an infinite number of fractional components, and continuous variables are limited by the precision of the testing instrument. So as an example, age can be measured as a discrete variable if we only count years. So a person can only take on a value of 15 years, 16 years, or 17 years. But we can measure age along a continuous variable if we consider age in months, weeks, and or days. So we have to consider how we operationally define the variable as well. Now, central to the use of the procedures to generate descriptive and inferential statistics is defining what a dependent variable is. So a dependent variable is that variable that measures an outcome. This is what we're interested in with a research study. So as an example, the results of a federal election is the outcome, and that's something that we're interested in. So one possible outcome of a federal election is, as you can see here, the Giraffe Party earns 68 seats, VW 34 seats, and of course the Party earns 20 seats. That's where it stops in terms of the numerical process. The number of SARS-CoV-2 infections in Ontario during the present pandemic is over 562,000 cases. So the number there is the final number. That is the number of interest that we're after. The median household income in Ontario is approximately $74,000 before taxes. And so that's where the number stops in terms of the information we're trying to gather. Now, the dependent variable, the value of that number, the magnitude of that number, will depend upon the independent variable. And so this is a factor that influences the outcome. That outcome is the dependent variable. So one way to remember this, when you hear the term dependent variable, it's a variable that depends on something else. The thing it depends upon is the variable that's independent. And that's really what inferential statistics are all about. So some examples to stay consistent here. If we go back to our first example of the results of a federal election, the party share of all the votes cast in terms of the seats in the legislature is the dependent variable. That's where our analysis stops. But what influences the party share of the votes? One of the independent variables in this case could be political campaign fundraising. So is this to what extent does campaign fundraising influence the party share of votes? Another example here with respect to the number of SARS-CoV-2 infections, which, as we established earlier, is our dependent variable. That's the outcome we're interested in. Residential location is a potential cause for a certain number of SARS-CoV-2 infections. So residential location would be, in this situation, an independent variable. In terms of household income has been shown to be affected by level of education. So once again, the household income is the dependent variable. That's the outcome we're interested in. It is dependent upon the level of education. Our study of quantitative methods and statistics in this course will allow us to establish an understanding of the extent to which these independent variables influences the dependent variable. So one of the factors that influences our ability to arrive at conclusions from research studies and the information that we gather is the precision of the measurement tool. So the measurement tool could be a survey, could be a questionnaire, it could be a stopwatch, a ruler, anything that we use to obtain information from people. So when we talk about the precision, it refers to the exactness of a measurement as an assessment of how sensitive that testing instrument is with the particular variable of interest. So one example here, and this is a picture you see here, this is a standard heart rate monitor that people purchase and they use while they're walking or exercising. The heart rate monitor here is measured in whole numbers. And in terms of measuring heart rate, even though we're not using fractions for heart rate, this is an acceptable and valid level of precision. In terms of surveys and questionnaires, we tend to have slightly less precision as compared to something like measuring heart rate. And so to address a limited precision of surveys and questionnaires, one option is to add more options or categories for possible responses by people that fill out the questionnaires. But there are potential issues that arise if we have too many categories as well. So there has to be that optimal level of precision where sometimes more isn't necessarily better. There are 4 different measurement scales that we'll discuss right now at this point. The first scale is often considered the lowest level scale, the simplest way to classify an outcome of some measurement, and that's a nominal scale. With this type of scale, we're just identifying different levels and categories without measuring or assigning value to those measurements. It just simply places responses in different categories or in different groups, and one group isn't necessarily better or of greater value than another. So as we'll discuss in the next video, we'll take a look at a Likert scale, and we'll ask this question in the next video: do professional athletes make too much money? And we'll ask that question in terms of not evaluating the athletes per se, but people's perceptions of how much money professional athletes make. So a Likert scale provides a greater level of precision than just simply asking or providing one of two possible responses, yes or no. So in this type of situation, for a nominal scale, people that answer yes or people that answer no just counts how many people. It doesn't necessarily say the yes responses are better than the no responses, or vice versa. Measuring gender, males and females. Again here, it just establishes different categories. And there are certain criteria for a variable to be considered on the nominal scale. The first criterion is that the categories must be mutually exclusive. And so that each case, so each response can only fit in one category. There's no overlap between categories. So if we ask the question, do professional athletes make too much money? A person would answer yes, or they would answer no. They're mutually exclusive. One doesn't affect the other. It must be exhaustive, and so a category must exist for every possible score that might be found. So we have a finite number of categories from which we can place the outcome of our survey or our questionnaire, and it must be homogeneous. So categories, each category should include cases that are comparable, and we'll see where this is a potentially problematic if we use a simple yes/no option for asking the question, do professional athletes make too much money? The next scale up is what's called an ordinal scale. And a good way to remember the ordinal scale is just the word. This is a scale that establishes order. So on the nominal scale, there was no inherent value to each of the categories, but with an ordinal scale, what we're doing now is we're starting to place responses to a questionnaire or a measurement in different categories that have a ranking to those categories for some purpose. And the scores only indicate a position, not a magnitude between the different categories. And so what we're going to say here is that category 1 is different from category 2, which is different from category 3, but there's a definite order in those categories. And we'll take a look at an example here in a moment. So opinion surveys might use an ordinal scale. So the researcher might actually indicate agree or strongly agree as some sort of order that exists with a person's with the outcome of people that complete the survey. The example we'll take a look here is a clinical measurement of muscle strength, as you see in the photo here. So here we see a patient being tested for their leg strength by a physiotherapist, and the physiotherapist makes a subjective estimate based upon that manual resistance. So based upon their estimate, their subjective sense from their experience, they'll place the response here along particular grades. And so we have an order from 5, 4, 3, 2, 1, and 0, where 5 is the highest level, which is 100%, which is a numerical value that has a qualitative description here as normal strength, as defined on the fourth column here on this table. If we take a look at a 0 grade, or 0%, has the qualitative value of 0, defined by the scale here. There's no evidence of muscle contractility. And between 0 and 5, we have an increasing grade, increasing qualitative values, and we'll see increased functionality of the person's muscle strength. And so this is often used clinically and is used in a variety of different venues in terms of measurement scales. The third and fourth measurement scales, which we'll define on this slide here, is the interval and the ratio scale. The interval scale, these two scales, starting with the interval scale, actually describes a quantity, a magnitude, how much exists of what it is we're measuring here. So we're starting to apply numerical values. Equal amount there's an equal amount that separates each score, so there are key intervals between each score. The interval scale is one that is used in which the response can have a negative value, and so there is no true zero in this situation, such as temperature. When we talk about temperature, we define temperature in Celsius or Fahrenheit. It can have negative values, but it doesn't have to have negative values. It's just the interval scale just allows that. Age, if quantified in years, where we have a difference between 3, 4, 5, 6 years of age, would fit the interval scale definition, as does income in terms of dollars. And so the variables in this situation we would define as temperature, age, and income, and then define the units of measurement, so Celsius or Fahrenheit, years, and dollars. The highest level, or the fourth level of measurement scales, is referred to as the ratio scale. In this case, the scores represent the true amount of the variable that is present, and it's scaled to a true zero, where in this case, the zero represents the absence of something. So once again here, where we see income here as a quantified on an interval scale, it also meets the definition of a ratio scale also. So there is considerable overlap between interval and ratio variables, and so it's not uncommon to read certain ratio scales that are treated as interval and vice versa. And this ends our third video here on our introductory unit.